a very good evening and a very warm welcome to the Facebook Live session. I'm Dr. Himani. I'm a developmental behavioral pediatrician and a co-founder of Continua Kids, which is a child development center chain in North India. We have about 17 child development centers in the northern part of the country. And I would like to, first of all, a big thanks to Autism Connect for giving me this opportunity to connect with so many parents and address so many parents and provide them with inputs about what is the role of a developmental pediatrician in management of children with autism spectrum. Very commonly, we have seen that parents, once their pediatrician tells them that their child has some red flags, they would go to either a speech therapist or maybe a occupational therapist, and they start intervention, although they're not really sure, is my child having autism or it is something else? Will my child be all right or not? There are so many questions around the fact they keep Googling and then they are in doubt whether my child has autism or it is something else. Will my child be all right or not? So that is the point where comes the role of a developmental pediatrician. Now, who is a developmental pediatrician? What is their training? Because this is a new term in India and this is a new specialty in pediatrics, which has been there in India now for some time, 10, 11 years, but not many people are still aware about it. So developmental pediatricians generally take their basic MBBS degree or their general 4.5 years of MBBS training, then 1 year of internship program, then they do post-graduation in pediatrics, which is about 2 to 3 years, which is then post that they do another post-graduation, which specializes in developmental pediatrics, which is around additional training, knowledge, expertise, experience around various neurodevelopmental disorders and anything which is related to developmental concern of a child. So that is how that they get additionally trained to address the needs, developmental needs of children. They specialize in that and they gather additional knowledge, information, and their the learning is completely dedicated to that area. So that is how they specialize. Just like we have a pediatric gastroenterologist who will address the GI concerns, and there is a pediatric neurologist who will address the neurology concerns. Similarly, we have developmental pediatricians who will address the developmental needs or behavioral challenges of a child with any kind of deviance from the routine path of development, right from making diagnosis to planning intervention. Now, they would check the development, they will evaluate the learning of a child and anything which is related to behavioral problems. So all these domains will be taken care by a developmental pediatrician. Now, what are the conditions which a developmental pediatrician would be addressing? Conditions like autism spectrum, conditions like ADHD, learning difficulty, language disorder, speech delays, developmental coordination disorder, and any deviance from the routine development, behavioral problems. All these will be evaluated, assessed, and treatment planning will be done by the developmental pediatrician. Mostly, who are the people who can refer the child to a developmental pediatrician? The first is a parent or a caregiver. If they are aware that experts like these exist, then they can directly reach out also to a developmental pediatrician with any developmental needs. Then there can be your general pediatrician, a clinical psychologist, or a school educator, or a early primary school teacher, or it could be a school teacher in the middle school. It could be school counselors, family physicians, family doctors. Any of these people can suggest or refer you to a developmental specialist or a pediatrician for detailed assessment. Now, how do we developmental pediatricians evaluate a child on autism? Because here we are talking about the role in a child on autism. So detailed history, as in, is there a medical history, how is the social structure like, how is the family like, is there any family dysfunction, or are there any additional behavioral problems? Is there a family history of any of the developmental delays? So all these areas need to be looked into and they need to be addressed. And this information is collected. Then we do a detailed general medical examination. We observe the child. We make a behavioral observation for a certain duration. If one observation is not enough, we would make more than one observation. Then you speak to the you speak to the child, you talk to the child, evaluate the child, and you note down certain points which are like deviation from the regular development. You seek feedback from the caregivers, from the teachers, everybody, and you collect and collate all this information and put it together, and then which will lead you to making a diagnosis. So all this effort, which probably a general pediatrician may not have that much time to collect all this information in detail, there the role of a developmental pediatrician comes into play. So now it's important that, okay, we have collected all the information, the diagnosis is done. There are a lot of times in children on autism that there could be coexisting micronutrient deficiencies which can increase the challenges which a child on autism may experience. So it's important to look at the child from head to toe. Is there a neurocutaneous marker while examining the child, like some marker which will give us a clue towards a genetic diagnosis or a clue towards a neurological diagnosis like tuberous sclerosis? So there are certain cues which will tell us what is the actual diagnosis of the child. There could be certain conditions like neurofibromatosis, phenylketonuria, or a genetic diagnosis like Fragile X syndrome or tuberous sclerosis or chromosomal abnormalities. All these can be there which need to be evaluated and which need thorough assessment. Which need expertise from the specialist to be able to diagnose these conditions, and that is where the role of developmental pediatrician comes into play. So it's very important that the developmental pediatrician is visited at least once in the beginning when you have those red flags or sign in your mind that, okay, my child is having some kind of challenges or is suspected on autism. So a detailed physical examination, a detailed behavioral examination is done. And during performing a physical examination, we rule out all the cues which indicate towards syndromes or any cause which is related, or any cause which can be modified or a genetic cause towards autism symptoms. And then comes, once we have ruled out that there is no specific cause, it's a primary on an infantile autism, then we need to figure out, what kind of investigations are required? Are they required or they're not required? So if the child appears anemic, then we must, all these micronutrient deficiencies like anemia, vitamin D deficiency, B12 deficiencies must be ruled out, which again cannot be checked by any other professional other than a pediatrician. Either your general pediatrician looks into it and treats them, or when you reach out to a developmental pediatrician, they will look into all these additional existing deficiencies, and they need to treat them because deficiencies of these micronutrients can exaggerate the behavioral problems, can cause further developmental delays in a child. So these, like if the child is anemic, again, their cognitive development will slow down. If the child has hypothyroidism, the cognitive development will slow down. If the child is having vitamin D deficiencies, or the child has any kind of a deficiency, B12 deficiency, the development of a child will slow down. And maybe just by simply supplementing those micronutrients, you can actually help the child develop better. Even if a child is on autism, we need to look for all these coexisting micronutrient deficiencies and treat them from time to time. Then comes the role of identifying any comorbidities. Is the child having any coexisting challenges along with their current, like, does the child have any GI disturbances? Child is having increased stool frequency, or is constipated, or the child is not sleeping well at night. So if the child is constipated, their behavioral problems will increase. They may start jumping more. They may be restless throughout the day. They may be gassy throughout the day, and they will not be able to focus, and they would be just walking or hovering around. Their appetite may not be adequate. If the child has feeding problems, again, the child will not eat everything, will have preferential food ingestion, and that will lead to some kind of deficiencies again, because the child is not eating all kinds of food and they have specific preferences to consuming certain foods only. So if the child is not sleeping well, again, the next the child will be restless, irritable, groggy, sleepy, will not be able to pay attention. So all these comorbidities also impact the learning, impact the outcome of a child on autism. That is why it's important that these comorbidities are also looked into in every single child on autism, and they are also treated simultaneously. Then is the child having ADHD? We know that we can treat ADHD with medication. So a child on autism with ADHD, you can definitely use medication to at least reduce the hyperactivity symptoms through the medication and let the child learn better. We all know that there's no medication available to treat the core symptoms of autism spectrum. So it's important that we at least keep the comorbidities well managed so that it does not add to the brunt of existing challenges in learning that the child is having being on spectrum. So again, there can be communication delays which need to be addressed, and there will be various ways to address this communication delays. There could be sometimes, very rarely, although not very commonly, but some children on autism do have some amount of motor delay. They may be very hypotonic. They may not start walking on time as well. So those tone issues and finding out a reason, is there an associated neurological cause for it, is all done with the help of a developmental pediatrician. If the child has intellectual disability, then also we need to look into, because that helps us to prognosticate and tell the parent how long and what is the nature of journey that the parent is going to have with the child on autism. If a child on autism has 7 abilities, 7 skills, then we can tell the parent, okay, these are the 7 skills, the extraordinary ability in your child, and you need to harness them, and it will help the child cope up with in various areas. While if the child has intellectual disability, then we know that because of associated intellectual challenge, the child is going to learn slow despite providing the intervention. So that helps the parent to know how much effort is going and what is going to be the outcome or prognosis of our child on autism. So all these factors are taken into consideration when we are looking at a child on autism. And of all these, the most important thing is the correct diagnosis. So correct diagnosis comes through experience, through using the correct kind of diagnostic tools and using the correct method of diagnosis. It's not necessary at all to make a diagnosis in 5 minutes, or to just look at the child for 15-20 minutes and make a diagnosis. There may be borderline cases, there may be soft signs, there may be children with good intellectual ability who come sometimes report in middle school or in teenage with symptoms. So it's very important to have what we say now, what the mind does not know, the eyes cannot see. So it's important for the professional to have that information in the mind, then only they can observe those symptoms, put them together and make a diagnosis. Again, the diagnosis has to happen through DSM-5 criteria, and they have to be noted down. Then there have to be formal assessments which tell us about the developmental quotient of the child. How is the child developmentally sailing? What is the gap in the child's development? How are we going to reassess the child? When do we reassess the child? Who is going to reassess the child? All these questions will be answered and addressed by the developmental pediatrician. Now, once the diagnosis is made, is there any role of medication? We all know that we need to work at the core symptoms of autism. There's no specific medication to treat the core symptoms, but we definitely need and have medications to manage the comorbidities, like managing GI disturbances, constipation, or managing the ADHD, providing remedial support for learning difficulties, or having medication to help child with sleep disturbances. So we have certain comorbidities which we can manage with medication. So educating, informing parents about those medication, then parental education is extremely important as to how your child is going to learn, and that it is not a disease. So there's no need to typecast the child or it's just that the child is going to learn things differently. And the moment our parents accept, the whole society will accept the child the way the child is. So we do not there need to worry if our parent is well educated. So educating the parent about the outcomes, about the possible treatments, long-term outcomes, how the children can be taught, and what kind of interventions are scientific, which have evidence base, and what kind of interventions can really help the child. What are various accommodations which can be provided in the school. So all this information in the journey of a child on autism will be provided to you by your developmental pediatrician. So in short, when we say what is the role of a developmental pediatrician, they are your case managers. They are the case managers where they will be the center point, because we know autism cannot be managed by one person. It's a multidisciplinary approach we need to follow. Multidisciplinary approach is where we need behavior therapists, we need occupational therapists, we need speech therapists, we need special educators, remedial tutors, counseling psychologists, sometimes even neurologists. If the child has dental problems, we'll go to a pediatric dentist also. So it's a group of people who are managing, multidisciplinary people who need to be in coherence and interact with each other, exchange a lot of information about the child in managing the child. Then only they can be managed in the best possible way. So there the developmental pediatrician will become the case manager or the nodal point who will look into all the spokes of these multidisciplinary teams working with the child, and then following up. We start a certain intervention for our child on autism. We also need to see and track how is it helping the child. It cannot go on that occupational therapy started and for 1 year the child is undergoing occupational therapy without really knowing which goals need to be worked on, what are the modifications, have we changed the goal, are we progressing, are the symptoms getting better. So all these need to be followed up. What all domains are being worked upon, what is the improvement in different developmental domains, how much has the child improved, doing a subjective evaluation and then working via an objective evaluation where we use standardized questionnaires, tools, assessment methods to track the development of a child. Whether the child is on autism spectrum or any other developmental delay, we must be able to monitor the intervention and monitor the progress of a child. That is extremely satisfying when you see that developmental quotient of your child has improved. So that is where the role of developmental pediatrician comes into play. So they are the people who will supervise the team of interventions. They are the people who will guide you through the process of diagnosis, intervention planning, and starting the interventions, and then following up the progress of a child while these interventions are being done. So they are your partners in managing the child, and if you have the support of a developmental pediatrician around you in your city, you must reach out to them and so that they can guide you through this process. Lot of times developmental pediatrician also have additional interest in autism, and they take up autism as a super specialty, and they work towards gathering almost all the information, which is scientific, non-scientific, all information, all your questions around autism can be addressed by them, because that's what they specialize, that's what they learn, and then they practice and they have maximum experience. I did my general pediatrics 20 years ago. While doing general pediatrics, I came across a lot of children with developmental delays, and that's where we thought that children with developmental delays are simply referred to multidisciplinary teams in different nook and corner of the cities, and the parents have to take their child from OT to speech to different areas in the city. And they are again not supervised, they're not getting guidance adequately. So that's where I did my additional training in developmental pediatrics, and which I have been practicing now for more than 10 years. And we have created a system at Continua Kids where all interventions, therapies, modality of treatment which a child on autism requires are in under one roof, under supervision of doctors like developmental pediatrician and pediatric neurologists. So that completes the care, and also helps in providing the quality of care that our children need to develop in the best possible way to their true potential. So that is all I would say that I have in describing you today and introducing you all to a new professional. For those who haven't heard about the developmental pediatrician and their role, that is where I would say is the role of developmental pediatrician comes in play in managing our children. So have them in loop when you are managing your children, so that you get best developmental outcomes for your child while they are being treated. And thank you so much for having me on this program today.